Hi, it's Professor Kristen. Being a nurse can be very challenging. Being a nursing student, it is stressful beyond all. So I hope these videos help refresh nurses that haven't done skills and different things in a long time, and will empower nursing students to learn how to do skills correctly, evidence-based, and be an impact and a positive in a profession that I love dearly, nursing. So please like and subscribe to my channel, Professor Kristen. Let's start gloving. There's a couple things I want to just let you know before you start putting your gloves on. One, you should always don your dominant hand first. So I'm right-handed, so this is the glove that will go on first. So before the hand goes into the glove, pull your fingers in, tuck your thumb in or in even further, so that as you're going into the glove, it's an easier transition. So let's start sterile gloving. We want to don our sterile gloves after we have checked our packaging. You want to make sure you have the correct size. You want to check the expiration date. And do you have a non-latex glove, or can you use a latex glove? Always make sure that you check that. Then let's open our gloves. So each glove has tabs that are easy pull. So we want to pull slowly, opening our gloves. And then we want to take our package of gloves out. And we're ready to glove. Now the gloves, when you open up, you will see that you have hands and left and right, an L and an R. So we're going to face, you want the cuffs to face you, just as if your hands were going to go into the gloves. Now when opening anything sterile, we want to always start opening away from us. So we are going to open the gloves, pinching, so that it doesn't fold back on us. Then open towards yourself. And then there's tabs that run along the side. Make sure you don't rub your hands around on the packaging, because you actually would be breaking your sterile field, because there's an opening right down the center. So the tabs that run, you want to take your hands and you're just going to kind of come up under the tabs that are here. And with your thumb center, you want to just open the gloves, and I always do a little extra pull. And what that does is it lets it open and lie flat. If not, you could have it fold back on itself. And if that's the case, then you've broken your sterile technique. So first I want to take my non-dominant hand, which is my left hand, and I'm going to pick up the glove, touching the inner cuff area. Anything that touches the skin is considered unsterile. So I'll pick up that glove, and then I'm going to go ahead and take my dominant hand, pulling my fingers together, tucking my thumb. I'm going to go into the glove, and it's on. If by chance something happens and you get a glove that your finger goes into the wrong finger placement, then don't panic. Just remember you're sterile, and you can fix it once you put the other sterile glove on. So now it's time to put the glove on my non-dominant hand. So I then want to tuck my thumb in, pull my fingers in, and I'm going to scoop the cuff up so that I can go into with my non-dominant hand and not contaminate my right glove. So I'm going to go ahead and work up the cuff, putting my fingers in, 4 fingers, and then I'm going to go ahead and pick the glove up. Note my thumb immediately comes out. I always tell students to put your hitchhiker thumb out, point it, extend it outward, because then you won't touch anything with that thumb as you're putting it on your hand. I want to take my non-dominant hand just like I did the other. I want to pull my fingers in, tuck my thumb, and now I'm going to go into the glove, and I'm going to turn an angle for a second so you can see. I want to make sure that I'm pulling away so that I don't touch this sterile hand, gloved hand, to my one that is not sterile yet. So as I go in, I'm pulling away, and voila, I have 2 sterile gloved hands. Now, the thing that I love to tell my students is, at this point, don't do anything else but go to a clasped hand position, and that just keeps you out of trouble so that you don't touch anything, you're above the waist, and you are good to go. Just remember a few key points. At waist level to shoulder level is considered a sterile area. Anything from waist level and down is considered unsterile. And so if you drop your hands down, you have contaminated. If you reach down to go to the trash, you have contaminated. Always remember to work within this area, and you should be safe. I hope this helps.